5 stone, had 2 pregnancies, want to go into my 40s with a nice tummy. Okay, so what questions would you ask your plastic surgeon? Okay, there's 2 aspects. I'm going to break this down into. One aspect is finding out a surgeon that's appropriate for you in terms of qualifications, experience, and what have you. And the other aspect is finding someone who you will get on with. So the first aspect is the qualification side of things. So to be honest with you, Kerry, well, I was about to say it's relatively easy. It's not relative. It's actually not that easy, which is why you hear all these botched people. All these people have botched surgery, and then they say, "Oh, I didn't realize it wasn't a surgeon. I didn't realize he was a a GP, or he was a A&E doctor. I thought he was a plastic surgeon." Because actually, it's not that obvious, but it is relatively easy to check. And the way you check, so first of all, I would say you want a fully trained plastic surgeon, ideally. Now, if their surgeon is or has been an NHS consultant, then you know they are a fully trained plastic surgeon. So if you see on their bio, if they are working in a private hospital, there are private hospitals all over the country. So if you're working in one of the local private hospitals, BMI, Spire, Nuffield, Ramsey, one of the big companies of private hospitals, if you can only work at those hospitals if you are a fully trained plastic surgeon, which usually means you have hold a permanent consultant post in the NHS or have held a permanent consultant post. So if you go to your local BMI hospital, your local Spire, Ramsey, Nuffield, whatever, your local private hospital, the surgeons there will all probably work at the local NHS hospital and do work at that private hospital as well. And that you can be assured they are fully trained plastic surgeons. The other ways, and one of the issues is, you might say, why am I saying that? Surely everyone's a fully trained. They're not. There's a lot of people who aren't fully trained plastic surgeons who are doing this sort of thing. So how are they doing it? Well, they're not doing it at those hospitals. They often work for they always, I guess, for doing the major cases, working for there's companies that do this sort of thing, commercial companies, and they have their own hospitals. They usually only have 1 or 2 hospitals in the country, and you have to go to one of those hospitals, and so they can choose who they allow to work at those hospitals. But their surgeons often wouldn't be able to work at the local hospital local to you because they are not fully trained in plastic surgery and haven't got the right credentials. So that is why I say to people, if you live in Manchester or in Bournemouth, or anyway, somewhere think of somewhere in Edinburgh, if you live in Edinburgh, or so, anyway, wherever you live, there will be very good plastic surgeons, fully trained, who will work in the local private hospital, and you shouldn't have to travel large distances. Simply when people inquire to come to Birmingham to see me or us, not so much me anymore, but us at the clinic, I always say, look, there's good surgeons up in Edinburgh. I can often recommend someone. I know people usually around about. So you shouldn't really have to travel long distances. So the first question is, so training. So look for that. The other way you can check it, we're all encouraged to give our GMC number. If you've got a name like mine, Stiano, you're all right. You probably don't need that GMC number, but my GMC number is 4117214. Put that up on screen if you're interested. But the reason I say that is because you can check on the GMC website. If you go to the GMC website, which is GMC, I think -uk.org, I think it is, you can check a doctor's credentials. So the GMC, obviously, the General Medical Council, all doctors are registered with GMC. If someone says, "Oh, we're registered with GMC," like obviously all doctors have to be registered with the GMC in order to prescribe medicines. But you want someone who's on the specialist register. So have a look, and you'll see on the GMC website to see if they're on the specialist register, and to see, so they'll be either on the GP register if they're a GP, or the specialist register if they're a consultant, and then it will be a specialist register for a specialty, so orthopedic surgery, general surgery, plastic surgery, whatever. So you can check that they're on the specialist register on the GMC website. That's another thing you can do. You can check by name, but if they've got an ordinary name, there might be a lot of them. You can check by GMC number. So that's question. So that's the sort of credentials, I guess. I've written a book. Oh God, I've written a book. I got it in shot. Was it in shot? I tried to get it in shot. I've written a book. That's it. There. You see? Oh. Yeah, it's my book. There's me, Jonathan Steiner. Yeah, we're in a book, Kerry. Never accept a lift from strangers.com. You can get it. We can give it to you free. If you're in Birmingham, you can just drop into the clinic and we'll give you one. If you are not in Birmingham, you can order a free one, but you do have to pay postage and packaging, or you can get it on Amazon for $12.99. But you know, get whatever. So I've written a book on it, just talking about this training and what have you. So I think the training is important, and you'd be surprised how many people who aren't trained are doing this sort of stuff. But yeah, those are the sort of broadly speaking ways you can find a trained one. And experience and expertise. The problem with tummy tuck, no one really specializes in tummy tuck. No one really, in this country anyway, specializes in body contouring. So you'd be hard pressed to find someone who's a tummy tuck specialist, but you probably want to find someone who's done some tummy tucks. You want to see some results, maybe talk to some patients of their patients who've had surgery done. Reviews, people can talk about reviews being sort of fabricated and stuff, which I guess can happen. But I think, I do think it is good to look at reviews. Broadly speaking, you want to see pretty good reviews from people. I think most of us try and ensure that we get happy patients, because in this day and age, if you have unhappy patients, they can, put reviews quite easily any way you want. So those are the sort of credential side of things. I think the other side of it is the sort of getting on with the surgeon. I think that's really important. I was talking to someone about this the other day. They said that they had seen a surgeon, not plastic surgeon. I can't remember what it's for now. But anyway, orthopedic or something, anyway, whatever their problem was. And they said the surgeon was very abrupt, and they thought that was probably good, because in theatre you probably want to, someone who people will listen to and will sort of do things for. And I hear this a lot, and there's a quote in my book that, like I say, people will say, oh, he's a good surgeon, but he's not very good with patients. To be honest with you, I would argue against that. I don't think that is a good surgeon. I think you have to feel that you can get on with your surgeon. I think you have to feel like you've got a rapport with them. You can talk to them. You can ask them if you want to change the plan close to surgery. You don't want to be frightened of them, thinking, oh my God, I better have those implants because I don't want to say anything because they'll be angry. It's your body, it's your only operation you're ever going to have, hopefully. So you want to make sure it's absolutely right. So I think you've got to feel that you can talk to them and air your concerns if you think, actually, you know what, I might have a different sort of implant or a different size, I think, whatever it is. And similarly, afterwards, you've got to get on with them. You don't want them to say, oh, that's a great result, and you think, oh, I've got a bit of a knobble at the end of the scar, or this one's a bit bigger than that one. I'm a bit concerned, and they just sort of railroad you and tell you that's a good result. So I think you've got to get on with them. I think you've got to feel comfortable with them. I think that's really important. A rapport is really important as well. So that's not really questions. That's really just getting on with them. Have I answered the question? What are the main questions you'd ask your surgeon? I haven't really answered that, have I? I'm talking about more about doing research before. So what are the questions you ask your surgeon? We'd ask them about their training, about their expertise. I think if they get cagey or aggressive about that, or not aggressive, but cagey about it, you've got to think, why are they getting, I think most people, not many people ask it, to be honest with you, but when people ask it, I'm happy to talk about it because I'm okay with my training and expertise. And I think if you're okay with it, you'll be okay with the question. It is a bit awkward asking the question. I understand that. I tried it with an accountant the other day, and I said the same. I said, what's your training? And it is a bit awkward. I understand how people feel a bit, I felt a bit awkward saying it, to be honest. But, it's a big deal for you, this. You've got to get it right. So, yeah, so ask about training expertise. Maybe ask, what if you're not happy? What's the policy, or what? You can ask about complications. Ask them what complication they've had, what their complication rate is, maybe if they know what sort of complications they've had, or what you can expect. Yeah, get the book. It's all in there. It's all in there, Kerry.